entitled Putting It All Together, Part 1, Rules and Regulations, Protecting Your Practice by Sherry Regiani. Sherry and her husband David built their own dental practice in a small town in Michigan between Flint and Pontiac in 1979. They have recently opened a new 7-operatory office. Most of their 19 staff members have been there for decades. Sherry first began working as a dental assistant, then became a hygienist, and then transitioned to practice management. She holds national certifications in practice management, OSHA compliance, and HIPAA. Sherry understands the changing rules and regulations that have affected private practitioners. She is a highly sought-after consultant, speaker, and coach, and frequently speaks at IAOMT meetings. Please help us to welcome Sherry Regiani.
Thank you. Come on down. Just gonna let the last people get in the door. All right, this is an exciting topic. I know that it's after lunch and you are all just busting at the seams to get this information. Reality is we all have dental practices. We are involved in dental practices. If you don't own a dental practice, you work in a dental practice. The number one thing is we have to remain a viable business. So we collect what we produce and we protect what we collect. That's how we get to rules and regs. I'm pretty much a black and white person, but our patients don't see it that way. And anybody who's clinical doesn't see life black and white. You see lots of things going up in kind of an artistic manner because after all, dentistry is art. It's beautiful, it's graceful, it's a health science, but it's art. But at the end of the day, you have to practice what you preach and you have to collect what you have produced, and you have to protect what you have. So what we're going to do in this first half is really talk about protections and what you all need to do. First thing is that the doctor is the head of the office, should be. The doctor should be the captain of the ship. But if the doctor does not share his or her dream, you don't know which way you're going. And if you are somebody who's in the business staff, raise your hand if you're business staff. Insurance, billing, scheduling. Okay, business staff. You can only direct that ship, navigate that ship into the same waters that the doctor wants. But what do our patients know? Nothing of that. Absolutely nothing of that. So you have to communicate the message effectively. The common question, whoops, did I miss? There we are. Yeah, what do your patients remember? So the common questions, no matter what office you are, no matter where you are in the United States, comes down to about a half a dozen questions that are asked on the phone or emailed to you. Do you take my insurance? What does it cost for a crown? Do you use nitrous? Why can't you clean my teeth at the same time we're doing something else? Does the doctor use a rubber dam? What the heck is a mercury protection fee? And my favorite, do I have to have x-rays? Gee, I don't know. Last time I checked, doctors still could not look through people's mouths and look through the inside of your tooth. So, doctor, any doctors in the room? A few of you. Those of you who are staff members, take this home to your doctor. The team needs to say the same thing to the same situation every single time. But again, doctor is captain of the ship. If the doctor doesn't tell you the message, you are left to your own devices, which may or may not be accurate to the doctor. So communication, mass communication, telegraph, sounds and signals, and really came down to 4 sounds. SOS is 3, but all the others mostly came down to 4 sounds. So when the telephone was invented, about the same time, there was a 3-digit central office. If you're from Michigan, if you're from Clarkston, Michigan, everybody who lives in Clarkston who's been there at least 25 years is a 625 number. The newbies got 620. That was the central office. And if you lived west of Sashaba Road, you were 922. If you were in Ortonville, where our first practice was, everybody was a 627. What's your phone number? 4934. Because we all just memorized those last 4 numbers. If you think back to home numbers and pre-mobile numbers, you knew where your friends lived because of those first 3 numbers, and you just had to memorize the last 4. So, 4 sounds, 4 numbers. Maybe it's because our brain is kind of wired to click on 4 things at a time. So, when you have working recall, and your doctor sits there to Mrs. Patient and says, remember last time you were here for your checkup and we talked about tooth number 3. It's got a fracture right across the midline of the fracture between the MOD. We have to replace that amalgam. We are going to do a crown sheet. You remember all this, right? Because we talked about it. Because what do doctors do? They talk. And then he asks his assistant, Mary, would you just get an x-ray of that? I want to see the root tip end before we get started. Now, Mrs. Patient, like most everybody else, has a real life. And in her pocket is a list because she knows what she has to do on her way home is stop at the drugstore. She needs Band-Aids, toilet paper, black markers, and a 40-watt light bulb. That's going through her brain because just before she got out of the car, guess what? Her husband called and he said, you're going to the drugstore? Yes, I am. I need razor blades, rod of detergent, and pick up some pretzels for me. Now, doctor's talking about tooth number 3. She's already got 4 items in her brain. She's got Band-Aids, toilet paper, black markers, and the 40-watt light bulb, and now her brain's starting to leak. He said razor blades. Oh, God, I know he wants pretzels. There was something else. She's forgetting that he needed detergent. So, let's play a little memory game. What did Mrs. Patient just say that she needed to get? Raise your hand. Who remembers? Light bulb. What type? 40 watt. Who remembers something else? Black marker? Detergent? Razors? Band-Aids. There we are. Band-Aids, toilet paper, black markers, 40-watt light bulb, razor blades, detergent, and pretzels. But in the meantime, she was a little distracted. Did not remember anything about what doctor said about tooth number 3. And there's her list. Because this is what's on her brain, not tooth number 3. And even though doctor said tooth number 3, does she understand it? Probably not. Average span of remembering digits or items is very short, and it's about a 15 to 30 second memory. So you all did fairly well here. So how do you give patients their information? How do you give them a treatment plan? How do you give them informed consent? Are you talking verbally? Are you giving them a copy that's written that's consistent? This is something that if you are not doing this, who is on practice management software? Who is still doing everything on paper? Okay. Those of you with software, are you also having patients fill out something on paper and then scanning it into their chart? Okay. Does anybody read that after you do it? Okay. We hope so. Some yes, some no. Did you ever forget to unplug the iron or the curling iron? I know you don't use a curling iron. I do. Anybody ever forget something? Ever? Patients think that we remember everything about them. We don't. And we usually do everything in the exact same way. I can tell you almost every single morning I unplug my curling iron, but there are days I'm going out to the car going, go back in the house and make sure enough it's unplugged. But because we're human, we don't always remember things. So we're just going to go over basic types of memory really fast. Everybody know where they were on September 11th? If you're of a certain age, you know where you were when Kennedy was assassinated. That is an episodic, used to be called flash memory. Now that flash memory is a little thumb drive, we call it episodic. It's important, it's indelible, because if your brain is able to process what you see, hear, smell, taste, and feel very quickly and accurately, that memory is recorded. If you have a kid of a certain age and you ask them, why is my coffee cup broken? You might see some interesting reactions and head bobs and looking down, and they tell you a story about how the coffee cup got broken. Their sibling may tell you a different story. And if you ask them again 15 minutes later, they come up with a totally different story because their brain didn't see it happen the way that their mouth was telling you the story. Or who started this argument? It's because what is important to you, what you actually saw, will be there forever. The kid who broke the coffee cup knows exactly what happened, but they don't want to get in trouble for it, so they make up a story. But the story out of your mouth is never the one that actually happened. So, therefore, getting back to Mrs. Patient thinks that your hygienist is amazing because she made her feel so good. She did such a good job with her. So she's so very happy with her. She must be wonderful because, after all, I felt great. Oh, but the same patient thinks that it was really tough when you were getting that impression on tooth number 3. She doesn't have any other frame of reference for it. So, therefore, the dentist and the assistant have no recollection because this is the way impressions go. But what does the patient think? And by the way, since people only remember 5 to 20% of what they hear, you're going to forget most of this. Honestly, you will. I hope that you watch it. I hope you go back and you discuss it. But especially when someone's distracted, does he look happy? And what's on the bracket table tray right in front of him? Is he distracted? Probably. Probably. So what should patients know? This is the nuts and bolts of this whole first half of this presentation. What's the problem? What's going to happen if it's not fixed? And what's the solution? Every single time, make sure your office goes through this message with all of your patients. And by the way, if you don't write it down, it didn't happen. So, what's the problem? Tooth number 3 has a fracture in it. If you have a little tooth chart like that, and by the way, if you download the slide, you can just print this one up, or you can Google it or Shutterstock, get a photo, draw a line with a black magic marker. This is where the tooth is broken. What's going to happen if it's not fixed? It will hurt. Part of the side of the tooth will probably break off. And by the way, this doesn't happen on a Tuesday at 10 o'clock in the morning. It usually happens on a weekend or at night. And what's the solution? We're going to remove the broken off amalgam. We're going to do this very safely. There's not enough tooth left more than likely, and so we're going to protect the entire tooth with a beautiful tooth-colored crown. We write it down. We give them a copy of their treatment plan. Any handouts that you give them. Handout on CERAC, and patient appeared to understand. Or patient had no idea, should speak with spouse. So, now, these are some of the questions that we get asked all the time, or that I get asked. True or false? Do you take bite wings every 2 years on an adult, 12 months with a child? Raise your hand if you think that's absolutely true. Raise your hand if you think that's not true. Okay, somebody tell me why that one's not true. Sorry, say it louder. Once a year? Is that what your routine is? Who else has a different routine? What do you do? Or what do you do? You get a prize. Patient specific. So if you have a patient, somebody like me, I'm a class 1. I'm probably your easiest patient. I might need bite wings. You might just do them every 3 years just to make sure there's nothing that we miss that's going on. You get a 14-year-old who's now buying his own pop because he's got a paper route or whatever. Rapid decay, interproximal decay, you might be telling parent, we're going to do these x-rays. I know we just took them 6 months ago, but your child had 4 areas of decay last time. I don't want you to come back 6 months from now and have 4 root canal teeth. We have to arrest whatever is going on intermediate. So that is no longer routine. Routine x-rays are no longer routine. They are patient specific. What about number 2, when required by the insurance to have service done? Yes? No? Is anybody here a non-insurance office? Don't take any, don't file any. Oh, okay, that's a lot of you. Patients can still have the option to mail in insurance forms themselves. If you would like to be a little proactive, you can have a disclaimer that you give to the patient that says, if you file for insurance, your insurance may not cover this because they may consider it cosmetic unless we have an x-ray. Patient understands that the onus for payment is totally their responsibility. Okay. What about when the patient presents with pain? Yes? No? Most of the time, this is a yes. However, what if it's periodontal pain? What if they ate popcorn and there's something stuck there, or a peanut skin? So again, doctor has to diagnose, doctor has to agree on that one. Prior to extraction? Yes? Anybody say no? Good, you all win. I don't have that many prizes. Prior to extraction, 100%, always, always, always. In fact, I would say prior to even a crown prep, if your doctor can't see the apex, you need to have this conversation with your doctor. We need it for diagnosis. No brainer. Yes. Okay. Who owns that patient record? Doctor in the office. What does the patient say? I paid for it. Exactly. Who said that? You get a prize. Patients think that they own the record. They own a copy of the record. That one's for you. The information in that record is always yours and never leaves the practice. If the patient wants to see their record, they may. They may. You may not withhold even if they owe you $2,000. Referral source. Coming and going. If your referral source you sent out for an implant, that record comes in, it now belongs to your office. You send somebody out for an extraction. You document that you sent them to the oral surgeon. A copy of that documentation belongs in your record and is a part of your office record. New patient, patient transfers. What they request and what you give them may be two different things. Sometimes you'll get something that says all records. All records being x-rays that are less than 2 years old, and period charting. They don't need to see anything financial. No other office should ever see anything financial. I have been asked this several times before. If a patient is what we call an H patient, a headache patient, and we have notes in the chart, can we forward that on? You should never be forwarding chart notes. You'll breathe a sigh of relief. That headache patient is out of your office, but you do not transfer that. And you should not, if you're handwriting, or even if you're electronic, writing in patient pays late or patient checks bounce, that should never be part of any clinical record. On your financial record, yes, but only in a legal sense would that ever be asked for. And let's talk about copies. Who charges for copies? Raise your hand. What do you charge for copies? Yeah. 25? Who else raised their hand? And what state are you in? New Jersey. What do you charge? $10. And what state? Nevada. Are your records electronic or paper? Electronic? Okay, in the handout that you're going to get in part 2, you're going to see that the most you can charge is $6.50 for an electronic record. The states regulate. Again, doesn't matter if the patient owes you $2,000 or 20 cents. You can only charge for the record. Federal law trumps state law in this effect because some states have not kept up with federal regulation. And I will give you a state-by-state breakdown of what you can charge. However, when the patient requests a copy, the first copy is always free. A patient can always get a copy of their record at any time. Now, patients have been coming to you since 1995, and you have paper charts 20 pages long. First time is absolutely free. Sorry if you wrote in colored ink and you have to do a colored copy and somebody's got to spend their time doing it. First copy is always free. A year later, the patient says, hey, can I get a copy of my record again? I lost it. Well, I'm going to give you state by state what you can charge them because you tell them the first copy is free. However, if they would like just that update, sure, I'll be happy to just give you that updated page. Where is this important? Patients, I'm from Michigan. We have some patients who live half the year in Arizona or Florida. They want to have something to give to their other dentist. And then again, we all have neurotic patients who just want a copy of everything. First copy is free. For a provider, of course, you don't charge them. And from a legal standpoint, so a third party, I have 2 of them going on right now at home, suing their insurance companies. One case has had 4 different attorneys, and the attorneys have had sub-attorneys, and we have made copies. Usually, in my case, by the time I add up the per page, and by the way, in most cases, it's like the first 25 pages, X amount. After that, it drops. We add this into their software, into my management system, so it is under, if the patient's last name is Smith, and instead of Susan Smith, patient, it's Smith Legal. And that way, when the patient sees the ledger, and they see this extra $100, they're going, what is this for? This is because your legal system did not paid for them yet. Patient's not responsible, but you're still tracking it. And when that check comes in, and they do, because lawyers know the rules, we don't, you do get that. However, again, if you're just sending something electronic, which includes electronic treatment plans, electronic health records, electronic billing, and electronic x-rays, it's still $6.50 max, period, done. Okay, now, PHI, who remembers what that stands for? What is it? Protected health information. Ding, 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 you get a prize. Protected health information, that P can also be known as personal health information. So, I'm sorry, I just looked at the light. There you are. You're welcome. Protected health information is anything that relates the person to their treatment. So, children to parent. You have a 19-year-old who just had an endo done and a crown, and mom and dad, oh, that's right, mom and dad are still paying the insurance. 19-year-old is on the policy, and mom calls up, so, why do I have a bill for, let's just say their copay round number, it's $1,000. What can you tell mom and dad? Who wants to role play with me? Come on. Yeah, come on up.
Right now is that if you are over 18 years old, you can not release anything to the parents. It doesn't matter what, unless you have a release.
Okay, Monica is the person at the desk that I'm calling. Hey, so Monica, this is Mrs. Regiani. My son Joe just somehow accrued a $1,000 bill here. What did he have done?
I have to check on the age first.
Okay, but it's $1,000 that's now in my account. So when my husband comes home from work today, he's not going to want to hear that suddenly we have a $1,000 bill in the office. I didn't authorize this.
Okay, so I have to check the records on your son, see if what the balance is about, and I may have to call you back as soon as I get all the information.
Now, what do you think I'm going to feel? Rage, exactly. Okay, Monica, thank you for coming up. I'll let you sit down. Be proactive. In a little bit, you're going to see the informed consent that we made up and we use in our office. The reality is, up to age 26, a child can be on their parents' insurance. That child could be married with children of their own, but somebody else is paying that insurance bill. Parent is going to call, like I'm going to call Monica, and I go, well, I've got the EOB from the insurance company. They won't call it EOB. Got the statement from the insurance company. It says they got a root canal and a crown. Why did they have that? Without a consent, you can't say anything. And Mrs. Patient is not going to be happy. And Mrs. Patient gets to tell boy's father, who, by the way, might live in another state, will you pay that one? They're not going to be happy either. So always, if they are over the age of 18, you must have a child, young adult, do the informed consent. We'll get to that in a minute. Insurance company. What can you tell the insurance company? Everything that they need, but no more. So if it required an x-ray, you're setting the x-ray. It's got to have the date of service. It's got to have the tooth of service. It's got to have the procedure code attached to it. In some cases, in the second session, we'll go into some ICD-10 codes that you're going to add into it. But everything that is needed for payment is going to be there. Referral to another healthcare provider. Darned right, you're going to tell them. What's your name? Lindsay. Suppose Lindsay comes to our practice. Lindsay's been coming to our practice. She's a little girl. She's always been doing really great. Now Lindsay's married, and she comes in, and instead of being this beautiful class 1, she's got gingivitis everywhere. Lindsay thinks she's pregnant. I'm just throwing this out here, for example. But she's not 100% sure. So, one, we're going to need some verification. I've been Lindsay's hygienist for 20 years. We have a good relationship going. But she's, yeah, I think I might be pregnant. My gums are just bleeding all the time. I don't know what to do. So we're going to talk about diet. We're going to talk about stress. We're going to talk about some other things. But if I'm referring her to another healthcare provider, I'm going to say possible pregnancy. Now, Lindsay may have gotten a tattoo last week. That's none of anybody else's business. Lindsay may have gotten her hair cut. That's nobody's business. But what would relate to her treatment is information that you do need to pass on. And that is no longer protected because we're sending her to another healthcare provider. What about marketing? What if you buy one of the products that you see here today and you want to sell it to in your practice? Let me use something, for example, MI paste. Let's suppose you want to target market and you want to email all the parents of ages 12 and under. Can I do that? Raise your hand if you think I can. They gave me their email address. Raise your hand if you think I can't. And the rest of you, I'm going to assume, are unsure. Those last two depends what your notice of privacy practices state. Come on. Okay, notice of privacy practices. The rules changed in 2013. Just should say a little thing for number 6 and 7. Depends what your notice of privacy practices are. If you still have a privacy practice that is multi-sheets long, it's outdated. It should be 1 page. And 2 very important things that you must say is if you are marketing, how you're marketing and how you use it, or that you are not using any of their information to market. Second thing is that the patients have the right to know if you would like to use their photos or x-rays for anything. You will see some x-rays up here. One of them's mine later. If my husband were lecturing and he were having photos or x-rays of our patients sign a waiver. It is on their actual initial intake form. It's a separate line item. I authorize and allow my photos and x-rays to be used for science or research or presentations. So if you don't have that, add it to... Okay, I'm going to keep talking. All right, well, lucky for all of you, I even have a printed copy of this. So you would need to make sure that you have a separate authorization and that patients can also opt out at any time. So this is my scenario on the age 18 to 26-year-old. What you can or cannot disclose. Cost of care and payment arrangements. Sure, you can tell them. Why? Services provided, because it's on their EOB anyway. Well, they could read it from the EOB, but you cannot discuss why the 19 to 26-year-old had bombed out teeth. And then my choice C is none unless patient signs an authorization. So the young authorization says, I authorize I understand that while I am considered a legal adult and my health information is protected under HIPAA, someone else who may be paying my bill would like to know what these services are and why. Then you give them choices. Therefore, I am allowing you to share information with, and they say who it is and the relationship, and we allow up to 3. And then we say, but do not share information with. So one parent lives in one state, one parent lives in another area, they're not in the same household. It's important that while they say who they can share the information with, it's also important that they say who not to share the information with. One parent may be Looney Tunes, and a young adult child understands, hey, I grew up in the household, I know the rules, but do not tell this one, or do not tell grandpa because he'll go ballistic. Authorization remains in place until I turn age 26 and unless I notify the office in writing to change it. So the child turns 24, gets married, and forgets to tell you. And then later there's a little problem because, oh, didn't I tell you on the phone? No, remember, in writing. Oh, and by the way, you give them a copy of that. You can print it up for them. So there are some additional HIPAA protections. Can you find out what your spouse's pocket depths are if they don't want to tell you? No. Anybody here a hygienist? Okay. So if you saw Mr. Patient and now Mrs. Patient's in the chair, like I know he had 5s. He had 5s, right? Didn't he? Didn't he have 5s? There you go. All right. California. And I have heard a couple other states, but California is the only one I know for sure. This is critical. You have a 12-year-old or a 13-year-old who suddenly says, I am not opening my mouth for you and you can't make me. Now, Behavioral health information is kept private from parents. If you are referring this child who's been a cutie pie in your office, suddenly you have to refer to a pedodontist or somewhere else, you have a little bit of a conversation with the child, not with the parent. First, if you can't keep your mouth open, we have to bring mom in here or dad in here. They have to be witness to what we're doing, but I can't work on you. Now, you haven't said you're a behavioral problem, and I can't tell that legally to your parents, but you can say mom and dad have to be witness to what's going on here. So that's your only legal ground to stand on. If you refer them out, now if they've got a bombed out mouth and you've got 20 teeth to do, sure, you can say, I think your child's going to be much more comfortable under sedation dentistry. But you cannot say for, let's say, a deal on 29, your child needs sedation dentistry. But you can have the parent back there and say, I cannot work on your child. You can only do so much. And you can't waste half an afternoon trying to get a deal on 29. 18 and older, complete control, even if someone else pays for it. So, I just looked at that. Look at it. Bright lights now. Let's protect your information. You know what it is? So, HIPAA. Who knows what HIPAA Omnibus is? What is it? Accountability Act. Okay, Health Insurance Portability and Accountability Act. It's actually been around more than 20 years. It began as a way to share information between providers and to make sure nothing else leaks. If you had a chest x-ray taken at an urgent care center and now you have to go to a hospital and your provider said, well, I can't see that x-ray, it's back at the urgent care center. Well, now there's a way to share that information, to have DICOM films that can be like a PDF file that can be read by anyone, even though it's not quite there yet. So it started with the best of intention, but there was no teeth in the bill. High Tech came along and started to add some penalties. HIPAA Omnibus added huge penalties and huge responsibilities. So every covered entity, CE meaning covered entity, not continuing ed, dentist, have to designate a HIPAA compliant officer. Staff members, make sure your dentist tells you who this is. He may choose one of you. Basic training is required, and you can Google that and find out where you can get it. The covered entity must ensure annual training for the entire workforce. Doctor can know the information, but most of the time doctors don't know the information. It might be in their journals. It's in dental economics at least once a year. But let me tell you that they probably don't share this with you. You have to know, and the entire workforce has to be trained. By the way, you have to keep logs of it, and the logs have to be kept for 6 years. So we have, in our office, we have a monthly staff meeting. At the top of the staff meeting, under the standing business, we always ask if there's any HIPAA or emergency action plan items to discuss. And then I usually write in none noted. There is also a sign-in log, everybody who was there, and if anybody missed the meeting with my part-timers, they'll come back, we'll review it all, and they will also sign off on the date they signed, not necessarily the date of the staff meeting. So, HIPAA regulations. Emailing and texting appointment reminders. Do you use HIPAA compliant email and text? Okay. Every single time. Every single time. E-prescriptions. Has to be over a HIPAA compliant server. Sending x-rays to another provider. And by the way, Gmail is not HIPAA compliant. I've heard more people say that in the last couple of years. Oh, I just send it via Gmail. Gmail's not HIPAA compliant. We use MedSecure Mail. You can use, there are a lot of providers out there. They're very realistically priced. And any other information, including social media. One of our patients just this week made us cookies with our new logo. Really cool cookies, and you gotta see, it's on our Facebook page. It's really cool. But we said, can we put this on our Facebook page and can we give credit to you? And she stood there for a minute and she said, you know what, I don't want my other dental office to ever know I did this for you, because she's only been with us maybe about 2 years. So we just said, isn't this cool? One of our patients brought us cookies. If we had not asked, and my staff would have posted, Sue Smith brought in all these cookies, you can't do that. So make sure you get permission and then make sure it's in writing. Let's talk about some HIPAA violations, because this is the teeth, and this is even if you didn't know. So those of you whose offices the doctor has not sat down and done annual training, failure to properly release information to patients. You hire a new business person. She seems really nice. She was a receptionist years ago. She's coming back in the workforce. Her kids are raised. She doesn't really know much about HIPAA. And she sends your 21-year-old information to another provider. Parent wanted to know, mother wanted the x-rays sent, suppose it's third molar extractions. Without authorization, you cannot do that. Improper disposal. There was a time when you could incinerate records or burn them. Now they must be cross-cut shredded. Missing patient signature. Do you know that if you have a HIPAA form in your chart and it's not signed, it's as if the patient never got it. You have 2 Jim Smiths in your office. And Jim Smith is going to the endodontist, and you just sent the wrong patient's records. HIPAA violation. Discussing any information with patients and relatives, it's just fine to go home and say, you know what, it was a long day. I had such a struggle with tooth number 3 with this one patient, but you may not be walking in the grocery store and go, hey Sue, remember we had all this trouble on number 3, how's that tooth doing? No, HIPAA violation. Patients may come up to you, she may come up to me and go, hey Sherry, when I was in the office, do you remember that? Like it came up. That's fine. You can tell me whatever you want. I can't instigate that. Private information in public areas. Hey, did you know I think so-and-so's pregnant? It's none of anybody's business. What happens in Vegas stays in Vegas. What happens in the office stays in the office. Private health information over the phone in a public area. Anybody have their reception desk right next to where the patients are waiting to be called in, and they hear you talking on the phone all the time. So a couple solutions for that. 1, phones have cords. Move the phone over a little bit so it's at least in a little more protected area. 2, patient secure information can be answered on another phone, not the one right in front of you, so that they don't hear that you're confirming Mrs. Patient's appointment for a perio treatment Tuesday at 3 o'clock. This is Dr. Regiani's office. We are confirming your appointment at 3 o'clock. That's all you need to know. And by the way, if you're leaving messages for patients and they don't give their name, this is Dr. Regiani's office calling. Would you just give me a quick call back? Do not release any information. If you call my mobile phone, you're going to hear, hi, this is Sherry. Can't answer the phone right now. Leave me a message. I'll call you back when I can. But if you get the message, you have reached 248-877. You don't know 100% for sure. Or some of these that just go, well, I'm not here. Leave me a message. Do not leave information you shouldn't do. Not logging off a computer. Your computer should all have screensavers. Your screensavers should be automatic to go on after a certain number of minutes. And you can also get filters. They're a peel it off tension, but they don't gum up your screen. Put them on so it's frosted so nobody from a side view can see anything. They're very cheap. You can get them on Amazon. Including private health information sent over the internet. We said you cannot email information unless it is a secure site, and releasing information about minors. So let's see what it cost. You start from the far left side. Oh, sure, sorry. Okay. It's all, yeah. I know I do the same thing when I take a picture, but those are the ones I go through and I know were important. Yeah, back in the day I used to say, this is important, write this down. Now it's snap a photo. Got it? Okay, you're welcome. You might want to take a picture of this slide. This is the omnibus teeth. Omnibus is September 23rd, 2013. So Office of Civil Rights, Health and Human Services came up with a nice little plan of what we're going to charge you. Does our government have plenty of money for everything it needs? Dental offices, that's a new place to get funds. So, far left corner, individual did not know he or she violated HIPAA. New receptionist just answer the phone and look all the way across. These are the fines. And then, if it was willful neglect, Some doctor going, I don't care. I've been practicing 40 years. Ooh, bad, even more, very expensive. I'm going to go through these a little faster. These are some of the fines just recently. These are 2014. Photocopiers returned without erasing the hard drives. They contain information. Fax machines contain information. Take out the hard drive. If you've got a sledgehammer, you can smash them. But do not ever turn any of that in. These are business associates who have violated HIPAA. I'm going to flip these quickly. Mandatory risk assessment. You can look this one up on the slide. When you get home, walk through your office. Once a year, walk through. Check all your doors, locked, secured. Anybody ever leave the office and go, ooh, window's open? Got to go back in there, shut the window. Make sure somebody's responsible every night. Every person in every area. Check your workstations. Okay? Self-assessment. Once a year, you must go through everything. If you have any paper charts, are your files locked? If they're not locked, spend $1,000, get a locking file cabinet. It's better than a $50,000 fine. So, meat and potatoes. What do you do if you lost a cell phone? Does your cell phone or your office cell phone have a way to self-destruct? Can you send it a message and everything's obliterated? If you're using it at all for patients, if you are texting patients back and forth, confirming appointments, sending prescriptions, answering emergency calls, you have to have a way to turn that off. If you are canoeing and your phone falls into a river, you're probably pretty lucky that nobody is going to be able to retrieve data, right? But if I'm at a convention center, I leave my phone. I don't know where I left it. Now, end of the day, I can't access my phone. If you have software on your phone that I know Dentrix and EagleSoft software can be accessed by a mobile app on your phone. Anybody have more than 500 patients in their office? That should be all hands up. I've got over 7,000. That's a huge breach. First phone call would be made to authorities, sheriff, state police, wherever you are. Got to report this as a theft. And then the rest of it is depending on your malpractice carrier. For the rest of these slides, you're going to contact your malpractice carrier and see how they want things handled. So, phishing threats. Never, never, never answer stupid emails. This is one of my favorite ones. Bogus emails can look like they came from a boss or their HR department asking for employees' date of birth and social security numbers to verify the new payroll system. NBC News was caught on this one. More than half of the staffers fell for it and released all that information. And if you had the news on this morning, Experian experienced a breach in July. Just reported today. Depending on the size of the breach, OCR, Office of Civil Rights, will tell you when you need to notify everyone. If you've ever had your information stolen, they give you Experian for a year or two. Except now, all that information is out there public. When you go home today, change every single password that you have. And don't reuse an old one. Seriously. Banking information, checking accounts, charge card information, Amazon orders, PayPal, all of that is now accessible. Use good professional software. Do not use the free version. Malwarebytes is the #1 company out there. You can get a free one for your home, but get the professional one for your office. $100 a year, it's worth it. And if you use a Mac, there's Malwarebytes now for Macs as well as PCs. OSHA mandates for your dental office. I know I'm down to less than 10 minutes, so I wanted to focus on Hep B vaccination records. You should have an employee file. All employees should have their own file, and there should be a separate medical file. Who is authorized to know if you get a bee sting outside the office? Who should know? While you're on the way, when an ambulance is coming, who should have that information? That's in a separate file. Hep B vaccinations. Your employees do not need to get the Hep B vaccination. That's a personal decision. My belief might not be your belief. But you need to have authorization, or you need to have employee fill out a form that says, fill in the blanks, I certify I have had Hep B maybe 10 years ago. When my daughter was born, I had to have, okay, so about 10 years ago. Or I and refusing Hep B vaccination. It's every employee's right, even in California, to say, yes, I have had it, or no, I don't want it. If an employee wants a Hep B vaccination, doctor has to pay for it, including follow-up. But you need to keep those records. By the way, every office in the United States has to do annual HIPAA and OSHA training. So it's not just dental. And then some citations. Oh, let's see. Failure to train, exposure plan, bloodborne pathogen standards. This has to be gone over every year. You can send one person for training. You get the book. Do not fall into the trap of, we bought the book. We got it from ADA. We are all set. That book has about 20 forms that need to be filled out, personalized to your office. So make sure somebody attends OSHA training and make sure that somebody trains everyone else. Failure to use personal protective equipment. That's another biggie. I'll leave this up for just a second. Photos, we good? Okay. So you train your staff. You say always, always, always you're going to wear protective eyewear. You're going to wear whatever we give you. And one of your staff comes up and says, oh man, I got something in my eye. Do you have protective eyewear on? Well, no, I don't like it. It's clumsy. It's awkward. I don't like it. You trained them. They did not follow the rules. And by the way, you have documentation that they were trained. So the onus, you cannot be sued. Again, I like to protect offices from getting the short end of the stick. Best way is to stay abreast. Google OSHA, and in my case, it would be OSHA Michigan, my OSHA. Follow the stricter of the two. Your state dental society may conduct annual training. I know Stericycle and Henry Schein do. Patterson I haven't seen lately that they do OSHA training, but I'm sure they would direct you. And cross-country education, where a lot of us have taken our training before, is now called FINE. But there are a lot of others. Somebody is going to be certified in OSHA. Okay? Now, just going through a couple things to keep your office safe. You may not know this, but in June, a new EPA standard came out on mercury separators. When you first read just the synopsis of the report, it appears that you can use your mercury separator for 10 years if it's not broken. Well, when you read the whole report, that's if it meets at least certain minimum standards. If you want to read the whole report and you want to go through it, you can Google it, or you can just put that into a search engine. Also, Mars is here. They're the only one that I know of that has a fully EPA compliant affluent water standard. Clean Water Act. 1972, 14 states, well, originally it was 10 states, now it's 14. But Maryland has done some cool things, just so you're aware of this. Mercury reduction. The largest sources of pollution and dental offices. So if this is valid in Maryland, it's probably valid in Nevada, and in Michigan, and even Alaska. If anybody wanted to get involved politically, you got a little bit there. I thank you for your time. Wanted to get done. We've got about 2 minutes if there are any questions. And then I have one other handout for you all. Any questions? All right. If there's anything on HIPAA that you didn't understand, I'm going to hand these on the way out for the break. Oh, yes. Records are owned by the practice, but you do have to provide one copy to your patients. No. Not the clinical notes. You must provide, and not the treatment plan, and not the, well, the financials, they are eligible for a copy of everything that they paid for. If your clinical notes just say number 19, MO, one carpal anesthetic, that's great. If you have someone who writes narratives that are not standardized, and we'll go through that in the next session, and there's personality information in there, you never release that. Yeah. So x-rays are the most important thing. I have a HIPAA omnibus questionnaire. Pick one up on the way out. If you cannot answer these questions, then your office needs training. Any other questions? Yes. What's on your notice of privacy practices? If your notice of privacy practices says, we do send out marketing information for products that we carry, we periodically send them out, they may be a benefit to you, then it's just fine. If you've never addressed that, you need to. And by the way, that your patients sign a receipt that they have been offered a copy of privacy practices. Okay? Thank you. I hope to see you all back here in about 15 minutes.